Hi everyone, today I am going to give a talk on depression, the signs and symptoms of. It's increasingly important that we are aware of the mental health of ourselves and those around us, so we can create a supportive network, not just in the workplace, but within the family network as well. So I'm hoping today's little talk will just maybe open your eyes up to what potentially people can be going through, and maybe you'll see something yourself, or you'll see something in those around you, and can then maybe offer that support and get them the help they need. So I hope you get something from this little talk. So what is depression? The textbook answer is: depression is when you feel persistently sad and unhappy for a long period of time and affects your everyday life. Depression can sometimes be viewed as trivial and not a real health condition. This is not true. Depression is a real illness with real symptoms, and is a very common mental health condition. Hopefully over this talk you'll see the difference between living with depression and having days where you just feel a bit low, a bit sad, a bit, yeah, having a bad day. Having a bad day is human life. We all have them. We all have days where we feel better than others, and it doesn't mean you're living with a diagnosed issue, a potential diagnosis of depression. Two different things, very different things, and we need to start realizing that living with depression isn't just feeling low. It's so much more, and it impacts your life in so many ways. So the severity of depression is usually categorized into the following. Mild depression has some impact on your daily life. Moderate depression has a significant impact on your daily life. And severe depression makes it almost impossible to get through daily life. And this is what I'm saying, the difference between having a bad day to living with depression. Depression can be virtually debilitating depending on the severity of the condition. And we need to wake up to, when we're talking mental health and we're talking mental illness, two different things as well. Everybody has a mental health. Yes, degrees of severity can be same with physical. Some us, our mental health is great, and not then on other days it's not so great. But still, again, it doesn't mean you have a mental illness. It just means you're just having a bad day. You're not feeling as confident maybe, but having a diagnosed mental illness or living with a mental illness that's not been diagnosed yet because you've not seen help. It's two different things, and we need to wake up to that. So signs and symptoms of depression can be avoiding contact with family and friends, avoiding social events and neglecting hobbies, not doing as well at work, continuous low mood, feeling upset and tearful, feeling hopeless and low self-esteem, lack of motivation or interest in things, feeling irritable and intolerant of other people, thoughts of self-harm or suicide, changes in appetite or weight loss gain, lack of energy, muscle aches and pains, and disturbed sleep patterns and low sex drive. Some people might see some of these things within themselves and say depression doesn't mean you're going to have all of them. You might have a combination of them, and it will depend on the length of time you've had those symptoms as well. before you come close to having a medical diagnosis of depression. As I say, when you go to the doctors, usually they say, come back in 2 weeks and we'll talk again, because they want to see what happens with those symptoms. And the textbook answer with the diagnosis is, if it's 2 weeks or more, then you've got a chance you're going to have a diagnosis of depression. If the symptoms subside before the 2 weeks stuff, turns out you were just going for a bit of a low patch, and you were just feeling a bit, lack of motivation. You're feeling a bit crap about yourself, but now you just feeling, you've lifted yourself up, and you feel great again. Living with depression is a bit different to being that you can't just lift yourself up out of it. It can have a massive impact on your life for a prolonged length of time. I've lived with depression on and off for nearly 20 years. And yeah, it's had a massive impact on my life. I've lost jobs and relationships due to it. It's not just about being sad and wanting to lock yourself out from the world. It has had a massive impact on my life. Provide opportunity. So the way to help somebody with potential mental health condition is what we call first aid for mental health within the workplace, or within the family. So these are the ways maybe helping somebody who's dealing with depression. We provide opportunity for the person to talk. If the person does not initiate a conversation with you, you should say something to them. It's all about asking somebody how they're doing, how they're feeling. Try not to use closed questions, going up to someone saying, "Are you okay?" Because they'll just go, "Yeah." You need to encourage them to open up. You need to ask them a question that needs to be answered with a bit more detail than "yeah." And if you really strongly feel that that person is suffering in some way, then ask again. Just until you're happy that they're okay, just keep the conversation going. But choose an appropriate time where you both feel comfortable without any distractions. Yeah, especially in the workplace, open office environment, somebody's not really going to be opening up to you about the difficulties they may be having. So maybe ask them to meet you, go for a walk, go and sit in an empty office and sit there and just have a conversation. You may not actually have to say much. As soon as you give that person the opportunity to speak, they might just allow themselves to talk through it, and that may be all they need. They may not need you to really say a lot, but you may be the first person who's asked them if they're okay, who's wanted to know and shown an interest, and that's maybe all they need to start opening up and talk about what is going through their head. So yeah, you may not even have to say much when somebody starts. So listen to them carefully, remain calm and provide reassurance. The listening is a big part. Don't be in a rush to talk. Allow that person to process what they're saying. You may be the first person they've ever spoke to about what's going through their head. So just allow them to talk and listen. And don't be too quick to offer a reply. So accept what they are saying without judging them and show your understanding. You may not understand everything you're being told. If somebody's been self-harming and like, or thoughts of suicide, you may not understand why somebody would do that to themselves, but you can be empathetic to the fact that they're in such a place that's where they're going. That's where their mind's taking them. So yeah, you might not understand, but don't judge. Gently encourage them to help themselves, for example, by staying physically active, eating a balanced diet, and doing things they enjoy. Under the current environment, doing things you enjoy is very restricted, so that obviously can be having an impact on people's mental health. But we can still control what we eat. We can still be physically active. We can still get outside. We can still go for the walks. We can go for runs, bike rides, and so we can still eat healthily. We don't have to be having the takeout and the bag of crisps and chocolate. Yeah. So we still have a lot of control of what we put inside our body and what we do with our body. And being physical does help with, well, it helps me with my mental health. Yeah. And it may help you. One thing that doesn't help is doing nothing. And if you're feeling low and you don't change anything and you just continue on that path, you could end up in that state of depression. So if they feel comfortable, you can help them access information and resources. A lot of resources. At the end of the slides, there's some signposts that you can give to people. But you're not there to diagnose someone unless you're professionally trained and you know what you're talking about. You're more there to listen and offer advice where they can go. So talk to the GP. Is a friend, if you're in the workplace, is a friends and family they'd want to bring into the conversation. And then also the charities out there that are doing great work, Samaritans and the like. There's help out there. And depression isn't one way. It isn't you've got depression, you're going to live with it for the rest of your life. There is a cure, or there is a point of you learn to manage your life around it, and you learn to understand yourself. You start. There are people who completely recover from depression and just get back to leading as happy a life as possible. And then there's people like me who have lived with it for years, and it just comes back every now and then, has an impact on my life. And then I get through it and start living life again. But now I've got to the point where through a lot of self-reflection and a lot of self-understanding, I understand my triggers, I understand what helps me, I understand what works for me. And I've got to that point for a lot of trial and error, trying different things. But so one thing that doesn't work is doing nothing. You've got to be prepared to put the effort in and the work in. So treatments for depression. So watchful waiting. As I say, when you go to the doctors, they'll usually send you away for 2 weeks, and this is what they call watchful waiting. They want to see over a certain period, usually 2-week period, of how your symptoms have progressed. So you may just get better over that period and might not need any help at all. But then you might come back and go, it's still the same, or it feels worse, and then the doctor then should start offering you options. Self-help techniques, talking to family and friends, exercise, diet, seeing mindfulness, books, publications. The reality is, the best person to help you is you. You can do all the therapies, you can do everything. They're all good. It's all great, but you've got to want to put the effort in. You've got to want to be behind getting that recovery. It's not going to work if you're doing it all half-assed. You've got to be in it, and it's got to come from you. You've got to start the process. Nobody can do it for you. You've got to start it, and you've got to be in it. So CBT aims to help you understand your thoughts and behaviour and how they affect you. CBT usually consists of a short course of one-to-one session with a trained therapist. CBT can also be delivered online. For me, CBT didn't work. I know, but I'd never talk to somebody about saying, don't do it. Do it. It may work for you. I know loads of people it's worked massively for and helped me. It's just for me, it didn't work. I didn't get on with it. It just wasn't for me. It's hard to explain. I just couldn't get my head around it. I couldn't get in it. So it just didn't help me. I found what works for me. CBT wasn't it, but I wouldn't advise anybody not to do it. I would advise you to do it to see if it works for you. Antidepressants, medication that can treat symptoms of depression. GPs often recommend antidepressant medication in conjunction with talking therapies. Antidepressants are a sticky plaster. They allow you a bit of time of clear thinking and the like. It will reduce some of the symptoms of depression, but it is a sticky plaster. It's not a long-term solution. It's not the answer. It's not going to get you better. It should be there to help you find your path. Don't look at him as the answer. Interpersonal therapy. So focuses on your relationship with others and problems you may be having in your relationships, such as difficulties with communication or coping with bereavement. Psychodynamic psychotherapy. I probably stumble on a few words here. Psychoanalytic therapists will encourage you to say whatever is going through your mind. This will help you become aware of hidden meanings or patterns in what you do or say that may be contributing to your problems. So mental health teams, if you have severe depression, you may be referred to a professional mental health team who provide intensive specialist talking treatments as well as prescribed medication. As I said, this is more the severe depression when it's verging on debilitating. It's having that bigger impact on your life. It's not enabling you to live any sort of life. You could be struggling to look after yourself, feed yourself, clean yourself, and then say risk of suicide and the like. And that's when potentially you could be put under a mental health team to ensure you're safe, you're healthy, you're looking at you get to the point where you can again look after yourself. So signposting for depression, obviously, these are just some of the places you can recommend somebody go to. Here we have NHS Choices. So it provides a wealth of information. Depression Alliance, charity for sufferers of depression. Mind, I think we've all heard of Mind and the work they do. Samaritans, again, I think most of us have heard of Samaritans. Depression UK, self-help organisation. And then Mental Health Foundation. So those are just some of them. There's more out there. It doesn't take much to Google. You find a lot of charities out there. So yeah, I hope that has been some help to use. I hope you've taken something from it. And I'll speak to you all again soon. Take care.